Welcome back. And it's my pleasure to introduce the next session, which is how to make EHDS a success, perspectives from stakeholders. It's also my pleasure to introduce my friend, Julien Venne, the moderator. Julien is a colleague and we have worked together at the ECH Alliance for over 10 years. He's a director and a director of DHS. He's passionate about digital transformation and social impact, and he's an experienced C-level executive with track records in large corporates, startups, governments, public authorities, hospitals, universities, and not-for-profits. As a researcher, Julien is affiliated with the United Nations University, the University of Maastricht, and the Manipal Academy of Higher Education in India. His research focuses on digital transformation, data governance, digital trustworthiness, digital democracy, behavioral sciences, health and well-being, and public international health. He's in charge of the Digital Health Observatory. And without further ado, I'll hand over to Julien.
Thank you very much, Bledin. Thank you. It's a pleasure to be here again after yesterday's day, which was full of good insight and a very interesting presentation. And today, my role will be to moderate an excellent roundtable and panel, which I will present. I will present my colleagues in a minute. The topic of today in this session is about the European Health Data Space, the EHDS. We have talked about it yesterday. The European Commission has published a draft regulation in May, and we will try with my fellow experts in digital health from different perspectives, from governmental perspective, from the industry perspective, from the patient perspective, try to analyze a bit this draft regulation, the impact of this regulation, and potentially complementary actions that we all have to take in our digital health community here. So just I will share a few slides before presenting the expert of the panel today. I will share a few slides just to highlight a few information about the EHDS, so the European Health Data Space, just for everybody having in mind what we are talking about. So first, what are the problems that we try to solve? When I say we, it's the whole European community of people working in health and digital health. What we try to solve? Well, basically, it's some relationships are broken in terms of data transfer or data sharing. We talked about that yesterday, and we will talk a lot about it today. And just before, you had an excellent keynote about this topic as well. We are talking about a space in Europe in order to share data, because we observe that we have some issues when we are talking about individuals, citizens, or patients to access their own health data, for healthcare professionals to access health data of their patients, for policymakers to drive their public policies with data and be able to have data-driven policies, and as well for the secondary use in terms of research and innovation. We know that most of the innovation, AI, medical device, mobile app, softwares in health will need a lot of data to develop their application, and we have difficulty at the moment in Europe to accept that. So the objective basically are to empower individuals to control more their health data, and so by it control better their health, to foster a single market as well for digital health services and products, thanks to the unleash of the data sharing. Ensure interoperability is one of the key objectives as well of this regulation, the interoperability and the security of health data with the manufacturers, and to have a consistent framework for the reuse of data. These are the main objectives of this draft regulation, as stated by the Commission itself in the document. Actually, these diagrams, as you can see, are from the Commission. So of course it will generate, or we hope it will generate, a series of benefits for the citizens, for the professionals, for the policymakers, for the industry and the startups and the academics for the secondary use. So we hope that. And what we have, sorry for this awful diagram, but what do we have in this draft regulation? What are the components of this draft regulation? I tried here to represent at a glance what we have at the European level, at the member state level, and the kind of elements that we will will develop in the next years in Europe within this EHDS regulation. Some aspects are related to national boundaries, some aspects are related to European boundaries. Some aspect of the regulation will concern the primary use of health data, and some aspect will concern the secondary use of data, so health data. So I won't describe this slide because it will be basically what we will discuss with our experts today, all the components and the elements of this draft regulation. We have 45 minutes, a little bit less now, so we will go directly to the panel because a lot has to be discussed. So I'm very pleased to introduce the three experts I have with me this morning to talk about the EHDS. Three ladies very involved in digital health since many years, having a huge knowledge, and you will learn a lot today from her. So first, without specific order, I will present you three. Welcome to this panel and welcome to the DHS Summit. So welcome Bianca Rouwenhorst. You are the Director of the Department of Information Policy and Chief Information Officer, CIO, at the Ministry of Health and Welfare and Sport in Netherlands. So welcome to you, Bianca.
Thank you.
Verena Thaler, welcome as well. You're Digital Health Manager at Medtecheurope. Medtecheurope is a very well-known trade association of medical industry across different sectors. You have people working in diagnostic, in medical imaging, in medical devices, of course, and we will talk with you about the point of view of this industry, important industry for Europe. Welcome, Verena.
Thanks for the invitation.
And our last but not least speaker is Jelena Malinina. Jelena, you're Data Director of EURORDIS. EURORDIS, a well-known organization as well in Europe, patient organization, an organization focusing on the patient experience, especially in the domain of rare disease. Your well-known network of patient groups and patient association across Europe since many years. You're very active and you have actually been a pioneer, I would say, of the digitalization of healthcare in Europe since many years. So welcome to you, Jelena, and very nice to have you on the panel. So thank you very much for joining. Of course, you will have the possibility during the session to put in the chat a few questions, so feel free. We have prepared as well an organization of this session, and I will jump directly in the first chapter of this session, and we will try to talk with our speaker, with our experts, about the primary use of data. So one of the first objectives, as I said before, of the EHDS is to facilitate, to enhance, to foster the data sharing for primary use of health data. Primary use means for the citizens and the patients to have access to the data, for the health professionals as well to have access to the data. The regulation is talking about improving this access both for patient citizens and health professionals to be able to put in place as well access services at the national level in member states, but as well at the European level with a new concept called My Health EU, which is a very important building block of this new regulation of the EHDS. So my question to you three, and we will start with you, Bianca, if you want. My question would be how the EHDS draft regulation is, in your opinion, improving this access both from patient citizens and from health professionals. Do you think that it's bringing this regulation a new element, and if yes, which one? It would be interesting as well to understand in Netherlands what you already put in place. And basically, this first objective of empowering the citizens, empowering the health professionals with the facilitation of data sharing, do you think, and how we can reach this beautiful objective? Bianca, please.
Yes, thank you, Julien, for this question, and also for allowing me to be present at this panel discussion. I like it very much. So I think it's important to note that the fact is that by My Health at EU has been developed already the last couple of years. So we are not starting from scratch on. It now allows a limited transfer of the European patient summary from one country to another via the national contact points of the e-health. This also means the patient summary is automatically translated to the language of the doctor in need of the summary. This will be developed further with more use cases, more health institutions connected to the national contact point under the EHDS. The eHealth digital service infrastructure facilitates the cross-border exchange of health data, including patient summaries and e-prescription. This is what we know as the EU for Health in the EHDS proposal. Through core services, the European Commission is providing a common ICT to EU countries. They can set up generic services to connect national e-health systems through national contact points for e-health. Many countries already have an NCP and are able to send or receive a European patient summary, for example. Coming back to your question, I do believe it brings new elements to the empowerment of EU citizens and patients. It eventually will create a level playing field, fostering better healthcare. And that's why we are doing this. Maybe ultimately having the right data at the right time at the right place. Exactly where the patients want and needs its data, for example, for treatment in another EU country than in the Netherlands or in another country. The EHDS is the first less voluntary and mandatory step in this. So yes, I confirm your question, the hearing.
Thank you very much, Bianca. Verena, maybe I can ask you now, what is the point of view of the industry you're presenting, but as well your point of view of experts? Do you see as well, like Bianca, as an improvement of the condition of access to health data, both for citizens and professionals, or do you see as well potential additional measure or additional actions that we should develop beside this regulation? Verena.
Julien, thank you so much, first of all, for allowing me to be on this panel, and second of all, for the question, because I think it's a very important question. And maybe to start with, I think, or general industry point of view is that the EHDS is a very promising endeavor. And I think it's very important also to say that we are supporting the aim to create the European health data ecosystem. Its adoption has the great potential to accelerate the appropriate availability and quality of electronic health data for the citizens and patients. So here, this new regulation really has the potential to harness the benefits of this new digital transformation and this digital age for better patient outcomes, better continuity of care, and so on. So it's a very promising endeavor, and of course it also enhances the availability for the data, putting the data at the hand of the citizens and patients. But to really harness this power of data, of course, we need to have a collaborative effort to create this European health data space. We were listening before also to the great keynote of Ms. Annika Fees, and she already outlined a few very important things. For example, the strong governance framework to ensure for these data flows, to create a legal certainty for the processing of electronic health data, but also the alignment with existing legislation for the healthcare sector. And also the use of infrastructures or the building of infrastructures, because a lot of effort has been already done. Bianca already mentioned it before, that there was a lot of effort in the member states and on European level, and a lot of different stakeholders did already a lot of effort in this regard. So the EHDS should definitely build on these existing efforts. And that being said, it will still require a significant amount of investment in regional, national, and European structures for the safe and secure collection, storage, and transmission of health data, including this connected medical technologies. There's definitely investment needed. Also need to have clear mechanisms for the primary use, but also for secondary use of electronic health data. And the EHDS also promises to achieve true semantic and technical interoperability across the EU. And therefore, we really need to allow for this seamless exchange of health data. And there we also need to be very careful in selecting the standards which are already out there and to rely on existing harmonized international and European standards. But above all, the trust of the citizens and for all involved parties, and the buy-in is really of utmost importance. So not just citizens, patients, and healthcare professionals, but also the expertise of other groups of like policymakers, clinicians, scientists, industry stakeholders. We all need to gain trust in this endeavor, and we need to have the buy-in of all stakeholder groups and a collaborative effort to really make the EHDS a success.
Thank you, Verena. Thank you very much. Yeah, a collective work, and actually, I think everybody agrees on this point of the multi-stakeholder ecosystem having to work together. A part should be done by the public sector, a part will be done by the industry, of course, in terms of investments. And this question, we will come back a bit later on this question of standardization and the fact that the data sharing is only possible if the system, the IT system, can communicate together. So we will come back to this question in a moment. Jelena, I will come to you now. What is your feeling about this draft regulation, certainly from the point of view of the patient and the citizens and their access? Of course, empowerment of citizens or empowerment of patients is a complex challenge, not only the access, certainly. So what is your take on this aspect on the draft regulation?
Thank you very much. So from rare disease community perspective, it's actually something long awaited, because you might know that there is a system which is established for many years already, which is European reference networks. So these networks, which were specifically designed by the European Union for rare disease patients to connect them with different healthcare professionals, because very often the cluster is very small. Some diseases are more common, but they are still rare, and there are ultra rare diseases when you have, I don't know, just few people in one country, so they often have to seek care elsewhere. Either go to the specialized center or also use the cross-border healthcare rights, which they have. So when it comes to the primary healthcare data uses, specifically the establishment of common and mandatory standards for the electronic health record exchange, that is something really awesome, which would help tremendously, potentially, to facilitate diagnosis, to reduce costs, and also the nervous cells of people who often need to repeat the certain tests or works in order just to have them with them in another country, which again tremendously delays the timing. Sometimes it means that the person does not receive the needed care and treatment at the same time and diagnosis. So with the help of the electronic health record, we hope that this will facilitate much more and empower patient as well, because then you have everything in front of you. It's much easier to follow your treatment route or your care pathway or whatever you have to do with that. At the same time, there are certain challenges potentially with the electronic health record, because we know that the digitalization is not happening at the same level at the country level. So some of them are already really advanced, some of them are really not there. So in theory, when we look at the draft proposal, it's great and it's promising, and I especially like the part about the digital rights, which will be enforced in the electronic health records. So people would have the right to information, to have their records, to ask for rectification, data portability, and all these super important pieces which help people to also trust the system. They're being enforced with the law. But then we look at the practical level, and I must say I'm a little bit maybe pessimistic / realistic in the terms when this can be achieved, simply because the alignment on the digital level is really diverse. It would push certain countries and it will open an investment line for them to introduce the systems, but it's not done overnight. It's not done even within 1 year. It will take quite a lot of time to be aligned with different standards. And actually, it's the first time when the EU introduces the mandatory standard for EHR. It was the case for almost 10 years while they were establishing EU health exchange format, while it was a recommendation still. So for many countries, they went for diverse standards. So it will take quite a long time, I would say, to have it in practice.
Thank you. So yeah, if I summarize, maybe, and correct me if I'm wrong, we are just embarking in a journey that will last certainly a few years ahead before achieving these results. But it's going in the right direction, if I understand you correctly. Even if we have to be realistic, all of us, of course, all the countries are not at the same pace and similar level. But the objective of convergence we have in Europe since the beginning of Europe, 50, 60 years ago, 70 years ago, is still playing here. Okay, in this primary use of health data, so we talked about the benefits, of course, for healthcare professionals and citizens and patients to access their EHR. The EHR, the electronic health record, is very mentioned in this regulation, and a whole part is dedicated to it. It's a basic data sets that healthcare systems are using in most of the countries. So of course, it's true that it's a good entry point. The wellness applications are as well mentioned as a potential source of data useful for citizens and patients and for health professionals in some case for the primary use. This draft regulation is proposing a new framework regulation around the EHR that will impact for sure the healthcare providers, hospitals, secondary care providers most of the time, but as well primary care with the tool they are using, and of course impacts a lot the industry that will have to adapt and to match the requirements and to comply with the regulation on the EHR. Actually, it is not completely defined, so still some work has to be done. Bianca, from a member state perspective and the Ministry of Health perspective, do you feel that the healthcare system in your country and in another country in Europe are ready from the healthcare provider side or from the policymaker side point of view? How do you react to this effort from the Commission to propose a regulation of the EHR, the electronic health record? Do you think we are ready?
No, we are not ready, no. And I'm.
But we will.
Yes, I think this will be a process for many years, but we have the obligation to do it as fast as possible because our citizens are asking for it. So. But we know that the impact is going to be significant. The exact impact is hard to grasp. So we are at this moment we are conducting national impact analysis on some topics such as the primary use and the market for the EHRS and the secondary use of health data and the EU governance and control, of course, as a member states. So we look at the judicial aspects, but also the technical and organizational, social and ethical aspects. In the Netherlands, we currently, 2 weeks ago, have a law passing through Parliament called the WEGIS, which aims a similar thing when it comes to electronic exchange of data for primary use. So the Dutch law makes the transfer of data between care professionals must be done electronically. It will be a smooth transition, starting with a few use cases and almost the same use cases as mentioned in the EHDS, such as a patient summary. However, the EHDS is a broader legislation than the WEGIS in our country. It not only aims for interoperability in primary care uses of data, but also secondary use of data, and that's not in the WEGIS. We support the idea of the EHDS in principle, but because of at the moment of the health data is not always available for delivery of care across the border.
Thank you very much. And an additional question maybe about the role that this draft regulation is assigning to the member state, the role of market surveillance on the EHR market. How do you foresee that? I assume it will have a huge impact on your organization as a ministry.
Yes, now we don't have this in place yet, as it is set out in the regulation. They're still trying to understand what the impact is nationally, and what the end result of the European negotiations of legislative process will be, of course. But it will create a lot of work to set up, that is for sure.
I can imagine how difficult and how intense will be the work in the next months to set up that in dialogue with the Commission. Verena, maybe from your point of view, so the industry point of view, you have number of members, I assume, editing and providing EHR systems or interacting as well with EHR systems. What is the reaction of the industry? How the industry welcome or not welcome this regulation? What is the point of view and the reactions toward this regulation?
Thank you very much. And I think this is also a very important question to ask. Well, the legislation sets out these rules for EHR systems and also the interoperability of these systems. I think we need to start at the beginning, because the definition of these systems is very, very broad. So in principle, this type of EHR systems is not only limited to hospital systems or any electronic health records that we imagine when someone is treated in the hospital, but it would also entail, or the definition as it is perceived right now, entails in principle any software solution that is in the digital health field with our connected devices and so on. So I think here it's also very important to ensure this legal clarity on, and to narrow the scope of these EHR systems to be very sure what is included with this definition. Then we also need to have regulatory certainty, because connected medical devices, as you probably know, are already very tightly covered under the medical device regulation, under the in vitro medical devices regulation. So we have a very strict adherence also when it comes to security and confidentiality of the data. So here we all have already very strict regulation. Right now it's unclear whether a system falls under two definitions, probably how to deal with it. So we really would ask for more certainty about the scope of this. When we talk about interoperability, I already mentioned it before. So the EHDS holds really a promise to achieve this true technical and semantic interoperability. And I think the interoperability of EHR, in line with this existing European electronic health record exchange format, and together with internationally recognized harmonized standards, should be strengthened. So the governance framework should also prioritize the standardization needs, improve data interoperability, and it should be an extension of existing, for example, the eHealth network or multi-stakeholder platform for ICT standardization. So in this regard, I really want to outline that it's crucial to create the link also to this international European standards development organization to really rely on what's already being done there. We have a lot of efforts being done already in the field of interoperability, these existing standards, and here it needs also a collaborative effort. And this also requires input from the industry, because as you said, we have connected devices which are feeding data into EHR systems and hospital information systems. So here we can also give input on the standards being used and can help and support in this collaborative effort.
Thank you, Verena. Yeah, the interplay with the existing work, because of course the interoperability, the elephant in the room, is something we are discussing since many years, 20 years almost about this topic, and many things have been achieved. So the European Commission, of course, mentioned the fact that there is an existing world of standards and interoperability models, both technical and semantical, which can be adapted. So I assume long discussion as well from your side, from the industry side, with the Commission and the member states to discuss this aspect.
Yes, it's very important to also consider this industry best practice also when choosing the kind of standards which should be used. And in the proposal, we see the use of common specifications, but we really want to outline that the use of internationally recognized standards would be very, very important in this field. And also when we talk about these standards, of course, it would also need transition times, because we have legacy products on the market which are already out there in the hospitals at the patients to create this added value, but it's hard to change them from today until tomorrow. Yeah. So we really would also need this kind of time to transition, and also being at the table when discussing the kinds of standards.
Yeah, when we know the effort required for the change of an EHR system A to an EHR system B in an hospital, we know that it will take time. Again, we are embarking in our journey. Certainly, you're right. Thank you very much for your insights, Jelena. From the patient point of view, the regulation is talking about EHR standardization, which certainly will help as well toward the difficulties or the challenges we are facing. You were mentioning in your previous answer different between the countries. It's talking about wellness app as well, mobile app for health, which could be useful in some case for the patients, but as well for the professionals. How do you see this effort I would say a rephrased effort, because this effort of facilitating the interoperability is not new, basically. But how do you see this approach in the draft regulation of the EHDS?
I was a bit surprised to see that, to be honest, because wellness apps has been a gray area for so many years. And actually there are good quality health apps and not so good quality health apps. And if we look, I don't know, on the market, if I go now to Google Play to see what health and well-being apps are available, I will probably have thousands of choice. So how do I choose as a citizen, as a patient, the one which is good? They're not labeled usually. So, and to be honest, I'm a bit skeptical about self-certification label, because the compliance, it's impossible to check this amount of apps. So if we're speaking about the limited one, where I know that some countries are introducing certain schemes, certain voluntary labeling to distinguish between the better quality app from the worst. Some of them do not have any added value. Some of them might have more added value. So considering the amount of products, to be honest, I think it's the future for the well-being apps to be connected with EHRs, but I do not see it happening immediately, because the first step would be actually to connect the medical devices, the apps which would qualify, the software which would qualify as a medical device, go through the certain procedures, certification, and so on and so forth. The ones who are reliable, the ones who are potentially also reimbursed by the state. So that would be the first ideal step for patient safety as well, because the well-being apps and the self-certification scheme, I think it's a bit premature, and they first should find a way to regulate the well-being apps before connecting them with HTC.
Yeah, I think it's about 500,000 wellness app currently on the market, whether it's Google Play or App Store. So yeah, you're right. The profusion, and we've seen within the EHR community, we've seen several countries or regions. I'm thinking about Catalonia, where I live at the moment, who try some scheme, but it's not easy. It's not an easy process, and I understand your doubts or your question mark in front of this thing. The time is flying very fast. I wanted to talk as well about secondary use of data. The other part of the regulation is talking about secondary use. So here we are talking about using the health data of citizens for research, for innovation, for policymaking as well in some case. Which is a bit between first primary and secondary use as well. So how we make available this data for the innovator, the policymaker, the researchers across Europe in a privacy preserving mode, I would say, because it states several times in the regulation that the privacy is key and the citizen privacy is key and should be enhanced through this regulation. A model of health data access bodies at the national level in member states has been set up in this regulation. It's proposed by the Commission. There are institutions that will go in between these health data access bodies, which can be one, which can be several in the member states. So it will depend on the negotiation and decision of the member states and the Commission. Will this model of transaction, and then after the draft regulation is explaining the whole process, data request, data permit, a series of provisions that will regulate the way the researcher or the innovator can have access to data or ask for having access to the data, and how the health data access bodies will deliver this access right or the data holder directly if it's one single data holder. So all this process is well described in the in the regulation, even if some complementary text should be added to it to precise a certain aspect. What do you think about this process and these new institutions presented in this regulation? Does it simplify? Does it complexify? What about the interplay of things that are already existing? Some member states have done already the effort to put some health data. I think about the health data hub in France, for instance, which is already active on this topic, but other member states have done as well a similar initiative. Do you think it complexify, it simplify? What do you think we should add or improve in this process of data access? Or do you think that we'll directly unleash completely the data sharing for secondary use? Bianca, perhaps your take on that as a member state?
There are many questions.
Yeah, well, it's not one single question. It was just your reflection, your take on this idea.
Yes, of course, yes. Especially on this one, we are still searching for what will be for our states the best possible way. We have a few national initiatives and organizations that are concerned with secondary use of data, and yeah, we are still trying now to grasp the impact of setting up a health data access body, and not only for the secondary use of data, but also maybe for the primary use of data. As such, in other member states is already in state. If developed and implemented with appropriate patient-centered view, this has a potential, I think, but only with the patient-centered view. I think that's very important to say, because that's where we are doing so. It can be a foundation for an integrated healthcare system in Europe also. Increasing availability of and access of data, but the proposal is ambitious, I think, and it's a long way and a lot needs to be done before we are there, and I appreciate all the steps we are now doing. So yes, I think that with the national initiatives who there already are and the new impact, we are looking forward to to get some results. I hope next year.
Thank you very much, Bianca. Thank you. Verena, perhaps the point of view of the industry, you have many members developing AI or machine learning solutions, and so they are really huge data users. They need to access data, and we know that most of the startups in Europe in this field are struggling sometimes to access data sets, should go to find some data sets labeled most of the time publicly in US. So not talking about European citizens, but US citizens and US patients. So it creates some difficulty to create AI or machine learning models. What do you think that this process set up in the draft regulation will help your members to have better access to data sets?
Julien, so I think, as you outlined, access to relevant data is a key enabler for research, ensuring that high standards of quality and safety of medical devices and innovation. And it's also very necessary for delivering innovative and personalized medical solutions to patients and users. So for us, it's very important. And I think these health data access bodies, we saw this process now in the regulation, and we need to be very careful here, because for us, I think it's very important to outline that approvals for data access should be really clearly defined and consistently used across the EU, and provide this timely access to secondary use of electronic health data. So in the implementation and interpretation of the EHDS and the provisions on the secondary use of health data, there needs really to be the harmonized access, because for us it would be very difficult if we would have different rules in all member states, and potentially also in the different health data access bodies within one member state. So there really needs to be this alignment and consistency throughout Europe. And also, of course, there could also be a risk of being kind of a bottleneck to this timely access. this access, because it really needs to be timely, to not having waiting times of 2-3 years to get access to the data sets, because it's very crucial to develop and innovate these state-of-the-art solutions for better care and outcomes for patients. So here we really need a very harmonized regime, but also when it comes to the fees for access, here also it should be harmonized and aligned throughout Europe.
Yeah, the question of the fees, I am sure, will be a very tough question to be discussed between the data holders, the health data access bodies, and the industry, and the data users, and the research, because it's not always possible. And actually, depending, it's said, I think, in the regulation, depending on the statutes of the data user, it can change as well. So I assume the industry want to be cautious on the fact that the fees are now rising too much to accept that. The timely manner as well is an important point you made. The fact that institutions like health data access body have the capacity to treat all the demands, and we know that these demands are growing because the type of digital solution we are building or data, where the data consumption is increasing, of course. So it's an important point. Thank you very much for these points. Jelena, I'm coming to you. So in this case, we know the effort of EURORDIS and the rare disease community on research and researching new treatments and developing and working between citizens, patients, and health professionals and researchers. Do you believe that this process you have read in the regulation like us in May will help this? What are the difficulties you have found in your existing network the last years? And in your experience, do you think that this regulation will help to solve a few problems?
That's a very interesting and complicated question. Let's hope that
Sorry for that.
No, it's totally fine. It's very interesting, but I think it might solve certain questions. It will not solve all of them. So very often we hear that the GDPR is the issue because, yeah, there are exemptions for secondary health data uses, and indeed it creates certain obstacles for cross-border research, which is crucial for rare diseases. And it's not only the research within Europe, but it's also the global research, because again, the scarcity of data and all the possible resources have to be used. At the same time, it's not the issue of the GDPR, and the EHDS will not also solve that completely, simply because if we go back to the treaties and see the division of competences between the EU and the member states, we will see that it's the member states who are responsible for the way they organize the research. And especially when it comes to any kind of provisions on genetic data, it's the unique responsibility of the member states. It's very little what the EU can do. And a lot of data on genetic conditions, which are often rare diseases, comes to the sensitivities at the national level. We do hope that the HDC will cover questions linked to cross-border research, so that the countries will be able to agree on one single way, on single rules. How do they exchange the data between themselves, remaining with whatever national preferences they have and with whatever national laws they have there. So we do hope for this improvement, but of course it would not solve absolutely everything, because then we are moving to one single state with one single healthcare system, and this is not realistic. Then another thing which is also important to discuss and to consider in the context of big data specifically, that traditional privacy tools are no longer necessarily working. So consent is important, but it's not the only unique thing which would protect everybody, because the consent in the context of big data sometimes becomes meaningless. The consent becomes meaningless in the area of AI, self-learning, and so on and so forth. So we need to consider other safeguards to protect not only privacy, but we're also speaking about discrimination, about potential profiling. So it's much, much broader than the safety of my data. We can be discriminated as groups. So there are many, many things which have to be taken into account, and to think of other mechanisms than consent and the medical confidentiality, which are traditional means in research, but they are still there, but we need to see them in different shapes and different forms, potentially think of dynamic consent shapes. Sometimes consent is not needed, because it will only be just, box ticking exercise, and it does not sometimes have a practical value. But then we need to think of other means, because again, if we do not have trust in the system, then the system will not really be working. So yeah, in a nutshell, I would reply to this like that. You're on mute.
Sorry, thank you very much for your answer. And to be concise, it's true that privacy preserving techniques could be multiple, and the consent has been installed by the GDPR. And actually, many questions are about the interplay between GDPR and this new EHDS draft regulation. There is one single article which was very, very touchy about the fact that we don't inform directly, or data holder or has data access body don't inform directly one single patient or citizens if it's used in the framework of secondary use. So which has created a kind of polemic around that. And do we suppress GDPR and come back to another more simple manner? Do we reinforce GDPR? What is the interplay between two? So many questions have to be discussed. I'm sorry, but we are running out of time. We had to finish 5 minutes ago, but of course, 3/4 of hour is not enough to talk about the EHDS extensively. But thank you very much for all your insights. Thank you, Bianca. Thank you, Jelena. Thank you, Verena. It was very interesting, I think, insights for the community. And I hand over to Bledin for the rest of the program. Thank you very much to all.
Thank you, Julien, and thank the panel. We'll take a short technical break as we prepare for the next session. Thank you. Back in a minute.